Hello, this is my persuasion speech. Imagine if you were terminally ill with a disease that has no cure. Every day you live with this unbearable pain, every day and night, and every night is sleepless. It's distracting you while you're awake, while you're asleep. You just can't live how you used to. Would you want to live with this unbearable pain until you die? Or would you want to have a doctor prescribe a lethal amounts of medication and cause your death? People who suffer from terminal illnesses sometimes take matters into their own hands, and those suicides are more painful than a prescribed medication, since suicides are sometimes so quick that family does not see it, as in they never thought that that family member wanted to end their life in any kind of way. If physician-assisted suicide was legal, people who suffer from terminal illnesses will be able to end their suffering from that unbearable pain that they may suffer every day. Some people think that physician-assisted suicide is just like euthanasia, and I will clarify the differences between those two. And I will clarify about the differences about those two, and I will be talking about other states and countries that have legalized it. And my sources are from an Australian study conducted on pharmacists and on their views on physician-assisted suicide, a journal from Legal Medicine, and 2 British medical journals. So, I will be talking about physician-assisted suicide, what it is, why people think, the ethical reasons why it should be legalized, other states and countries that have legalized physician-assisted suicide. So, physician-assisted suicide. Technically, physician-assisted suicide is when a doctor prescribes a lethal amount of medication to a patient who is terminally ill. And, of course, that medication will end their life. The difference between physician-assisted suicide and euthanasia is that physician-assisted suicide, according to the legal medicine, it lets the patient decide to administer this lethal amount of medicine into their body, and that medicine is prescribed specifically from a physician to the patient, and that will ultimately end their life. Euthanasia, on the other hand, is basically a doctor deciding on the patient's life, and of course, or a third party like a parent, a spouse. And those decisions are not made by the parent, or the patient, sorry. They're not made by the patient, so they don't get to decide. Someone else decides for them. So that's the difference between those two. They're still ending their life in a peaceful way, but the thing is that one is a choice, the other is not. So now that we know what physician suicide is and how it differs from euthanasia, let's move on to the ethical reasons on why it should be legalized. Physician-assisted suicide gives the patients with terminal illnesses the ability to decide on how to end their life, and to avoid that suffering. And some ethical principles that go into that would be respecting their autonomy, the non-malfeasance, and justice. So, respecting their autonomy. We should respect the wishes of those who make those decisions on ending their suffering, and not prevent them from making those decisions, because basically, to give someone autonomy is basically giving them the choice, giving them the ability to self-govern themselves, as in they can make their own decisions. So we should not let them stop making their decisions, because we should respect their autonomy, as in we should know that they are a person who can self-govern themselves without someone else telling them what to do. So the non-maleficence and justice. With non-maleficence, we should avoid causing harm to those who suffer, and we should avoid causing harm to those who are mentally competent of making their own decisions and who they decide to end their suffering. Basically, we should avoid causing them harm, because basically, if we let them live with the pain that they're living with, you're causing more harm than them deciding on ending that suffering. Just by deciding on them to keep on living the life with pain, that is, in my perspective, I see it as harmful, because you are harming them while making a decision for them that will cause them pain. With justice, we should not determine on the decisions. We should not determine their decision to end their life, because there are others who have the ability to reject treatment or refuse treatment. And so how could we give them the choice to refuse treatment that will basically save them if they should take it, but if they refuse it, then they can basically die because they don't receive that treatment. So how are we able to give them that option, but we can't give the option to other people to end their life because of that suffering that they're living through? I mean, we should actually respect their decision, since we actually don't know what they're going through. They're going through so much pain that we actually don't know what it is. So now that we know what physician-assisted suicide is compared to euthanasia, and the ethical principles of that we should think of when decided to avoid suffering, let's move on to other states and countries that have actually legalized physician-assisted suicide. So according to the British Journal of Psychiatric, physician-assisted suicide is legal in Oregon, Vermont, Washington, Switzerland, Belgium, the Netherlands, and Luxembourg. And in the state of Oregon, they have really strict rules on physician-assisted suicide. So in order to qualify for that, you have to be terminally ill, for that you only have 6 months to live, and it's an uncurable disease. And you also have to take a psychological exam to make sure that the patient is mentally stable and capable of making that decision. So it can't be something that will be irrational. And as well, in that state, the pharmacists, they actually know what prescription they're administering to those people who are going to go through physician-assisted suicide. So they know that the prescription that they're giving the person is going to ultimately end their life. So in countries like Switzerland and Belgium, they have more lenient rules. So for them, for assisted suicide, they let those who suffer from illnesses like chronic schizophrenia and persistent anorexia nervosa. So that means that not just people who are terminally ill can qualify for that, even people with mental disorders also qualify. And the thing is that in order to pass that, they have to be mentally capable. So in these two, the state and the countries, they have to be mentally capable, so they can't make a rash decision. So in those countries, you can't the pharmacists don't actually know that they're giving a prescription to those people who are actually going to go through the physician assisted suicide. So they don't actually know that those people are going to die. So that's the difference between the state of Oregon and those countries. So, oh yeah. So overall, even though there are people who say that physician assisted suicide is wrong and morally unethical, if physician assisted suicide was lethal, people who suffer from terminal illnesses would be able to end their suffering from unbearable pain that they may suffer every day. And by knowing what physician suicide is and the ethical reasons why it should be legalized, and knowing the states and countries that have passed those laws, physician assisted suicide will actually I hope that this will make it a little bit more clear on how we should pass this law, and to contact your lawmakers to pass a bill to make physician assisted suicide a thing and legal in our state. Because how are we going to grant someone a choice to refuse treatment but not give them a choice to take a medication that will end their life and basically end that pain? Let those who suffer from terminal illness decide on how they will end their lives. Give them the choice to avoid that suffering. Just give them the choice to avoid that suffering instead of telling them that they can't take one way or another. Thank you.